Ayes 38, no 0. Measure passes. All right, members, at this time, the regular session will stand in recess and the second extraordinary session will be convened. Senate third reading file, items 3 through 8. The prayer and the pledge will be deemed complete. We will now proceed to file item number 3. Senator McGuire. Secretary, please read.
Senate Bill 9 by Senator McGuire, an act relating to local government.
Senator McGuire.
Thank you so much, Mr. President and colleagues. Tobacco use is the single most preventable cause of death and disease in California and throughout this great country. Nationally, one out of every 5 deaths is attributable to smoking. Here in the Golden State, that adds up to 440,000 residents every year passing away from smoking-related diseases. And there are many different ways Californians can suppress this deadly habit. But time and time again, study after study focuses on the most effective way to reduce smoking, especially among young people, is the price point for the pack of cigarettes. In fact, according to the American Cancer Society, for every 10% increase in the price of cigarettes, there is a 4% reduction in the overall cigarette consumption and a 6.5% reduction in youth consumption across the state. It's clear price point moves the needle towards a healthier California. It has been 16 years since California last raised its tobacco tax, and during that time, we've seen our state's cost of providing health care for those inflicted with a tobacco-related disease increase significantly. According to the Center for Disease Control, smoking-related diseases cost Californians roughly $13.29 billion in medical expenses every year. The fact is, California has one of the lowest tobacco taxes in the nation, currently ranking 35th in the nation with a tax of 87 cents. The national average for tobacco tax is $1.60 per pack. New York has the highest at $4.35 per pack. Even Texas, yes, Texas, has a higher tobacco tax at $1.41, and Montana is at $1.70. Moreover, smoking disproportionately affects low-income communities. For example, African-American men and women have the highest adult smoking rates. The LGBT community smokes at the highest rate at 27%. And this is all the while lung cancer is the leading cause of cancer among Latinos. Smoking rates are higher among those who are younger, have lower incomes, and are either on Medicaid or have no health insurance at all. And nationally, over 600 local jurisdictions have their own cigarette and tobacco taxes. Unfortunately, here in California, no local cities or counties have a health-related tax of tobacco products because it's currently prohibited by law. I think all of us are focused on local control. And it makes sense to allow counties, who in many cases throughout California are the ones who are delivering healthcare services through hospital and community health center contracts, are able to invest locally in local smoking suppression programming that will help kick the habit of this deadly topic of smoking. Allowing local control is the right thing to do because the cost of smoking varies on a county-to-county basis. In Orange County, $375 per resident. In Lake County, where I represent, the poorest county in the state, $1,002 per resident. SB 2X-X9 is simple. It allows counties to place a local tax initiative onto their local ballot and let voters decide to impose a potential tobacco-related tax or not. To be clear, a county's Board of Supervisors would first need to put this to a vote. Mr. President, I respectfully ask for this body's aye vote and would be open to any questions.
Thank you, Senator McGuire. Any debate or discussion? Senator Anderson.
I'd like to take the senator up on his offer to answer some questions.
Senator McGuire, would you be willing to accept some questions?
Anytime, sir, and thank you.
Senator Anderson, please.
So when I looked through this, is there any limits on how counties can use these funds, or can they be spent on anything?
They need to be able to be spent on health and human service-related items.
Okay. And then is there any limit on the amount of what the taxes can be?
The other is, it's ultimately up to the county itself.
And then if the major counties were to move forward and let's say double or triple the current taxes, do we have any idea how that's going to affect the revenue to the state with our taxes on tobacco?
So the 87 cents would remain in place. So that's a guarantee revenue flow per pack coming to the state of California. What this would do is only focus on addition to the 87 cents that are currently in place. And the important detail of this is that a county can't simply put a tax on the ballot. All this would allow is for counties to put an initiative onto the ballot to let voters make that ultimate decision.
On my own time, thank you. Thank you, Senator.
Thank you.
If we want to ban cigarettes, let's just ban them. This slow approach makes no sense to me. I'm concerned that as we want to limit all the initiatives that go onto the ballot, but now we're going to allow counties to put these initiatives on the ballot. And let's just say that they 10 times the tax. I think it's silly for us not to believe that the revenue to the state would continue at the same rate. Even if that 87 cents is there, the number of people smoking, the number of cigarettes purchased would decline greatly. And maybe that's a good thing. I think it would be a good thing. But we're not talking about banning cigarettes. What we're talking about is banning some of the revenue that comes to the state that goes to the First Five Commission. So I'm not going to be supporting it today. If we want to ban cigarettes, I think we should take up that argument. This is not a consistent revenue source that we can count on, and yet we have programs that are designed to use this revenue. And I think we have to be very careful that we don't kill the golden goose. I urge a no vote.
Thank you, Senator Anderson. Senator Morlock?
Thank you, Mr. President. Since this is a bill that would allow for counties to put a ballot measure on the local ballot for a tax increase, how does Prop 26 play here? Are we required to have 21 votes or 27 votes?
So is this a question of the author?
It could be, I would think maybe someone could help me out. If this is a tax opportunity, does this legislature need a two-third vote or just a majority vote? Or does the two-thirds apply maybe at the local level? And
Senator,
so I could ask the author, the great senator from Sonoma. I just wanted to get a clarification.
I think go through the author. Senator McGuire, are you willing to accept the question?
Since this is not a specific bill related to implementation of taxes directly by this body, it is a simple majority vote today.
Okay, and thank you, Senator. I've been pondering this one pretty seriously, and I'm, again, just concerned that we had a national tobacco settlement, and now we're piling on top of that, and that's will probably weigh on my vote. So thank you very much.
Thank you, Senator Morlock. Members, any further debate or discussion? Seeing none, Senator McGuire, would you like to close?
Thank you so much. I'm going to end it with this. There has been a lot of discussion about subsidized medicine in this nation for the greater part of the last 36 months. There is no greater form of subsidized medicine than subsidizing the tobacco industry and the health impacts that are impacting Californians. 40,000 Californians, our friends and neighbors, die every year because of tobacco use. And now what I'm hearing is there's concern by some in this House about not letting voters make the ultimate decision to protect their community's health. And I would hope that we're voting with our hearts and with choice in mind. Let's give voters the choice at the local level. I respectfully ask for your aye vote.
Thank you, Senator McGuire. Secretary, please call the roll.
Allen? Aye. Anderson? No. Bates? No. Bell? Aye. Berryhill? Block? Aye. Cannella? No. De Leon? I. Fuller? No. Gaines?
No.
No. Galgiani? No. Glazer? Hall? I. Hancock? I. Hernandez? I. Hertzberg? Hill? I. Hueso? I. Huff? Jackson? I. Lara? Leno? I. Leva? I. Liu? I. McGuire? I. Mendoza? I. Mitchell? I. Monning? I. Morlock? Morrell? No. Wynn? No. Nielsen? No. Pan? I. Pavley? I. Roth? I. Runner? No. Stone? No. Vidak? No. Wachowski? I. Wolk? Wolk, aye. Berryhill? No. Roth? I to no.
Secretary, call the absent members.
Roth, I to no. Glazer? I. Hertzberg? Huff? Latta? I. Morlock?
Ayes 23, noes 14, measure passes. Members will now move to file item 4 in the extraordinary session. Senator Monning, are you prepared to bring this measure forward? Secretary, please read.
Senate Bill 6 by Senator Monning, an act relating to employment.
Senator Monning.
Thank you, Mr. President and members. Senate Bill 6 will close loopholes in California's smoke-free workplace law. California's landmark smoke-free workplace law was passed by the legislature in 1994 and provided the nation's first employee protections against exposure to secondhand smoke. Now, more than 20 years later, many Californians are still forced to work in employment settings where they are subjected to secondhand smoke exposure due to a number of exemptions built into the original legislation. This bill will remove many of those exemptions and will prohibit smoking in owner-operated businesses, employee break rooms, warehouse facilities, hotel lobbies, meeting and banquet rooms, and businesses with fewer than 5 employees. I ask that you join me in ensuring that all Californians can work in an employment setting that is free from the dangers of secondhand smoke and vote aye on SB 6. Thank you.
Thank you, Senator Monning. Any debate or discussion, members? Any debate or discussion? Seeing none, Secretary, please call the roll.
Allen? Aye. Anderson? Bates? No. Bell? Aye. Berryhill? Block? Aye. Canella? No. De Leon? Aye. Fuller? No. Gaines? No. Galgiani? Glazer? Hall? Hancock? Aye. Hernandez? Aye. Hertzberg? Aye. Hill? Aye. Hueso? Huff? Jackson? Aye. Lara? Aye. Leno? Aye. Leva? Aye. Liu? Aye. McGuire? Aye. Mendoza? Aye. Mitchell? Monning? Aye. Morlock? No. Morrell? No. Wynn? No. Nielsen? Pan? Aye. Pavley? Aye. Roth? Aye. Runner? No. Stone? No. Vidak? No. Wachowski? Aye. Wolk? Aye.
Secretary, call the absent members.
Anderson? No. Berryhill? Nielsen, no. Hall, aye. Galgiani? Glazer? Aye. Hueso? Huff? Mitchell? Aye.
Ayes 24, noes 12, measure passes. Members will now move on to file item 5. Senator Hernandez. Secretary, please read.
Senate Bill 7 by Senator Hernandez, an act relating to tobacco.
Thank you, Mr. President. Members, the truth, as Henry Waxman once stated, is that cigarettes are the single most dangerous consumer products ever sold. This bill would increase the minimum legal sale age for tobacco products to age 21. Tobacco remains the leading cause of preventable death, killing 480,000 individuals annually in this country, 34,000 of which are California residents. If the potential to save lives is not reason enough, there are also significant potential for cost savings by increasing the age. The Campaign for Tobacco-Free Kids estimates that Medi-Cal spends $3.5 billion annually to tackle tobacco heavily toll. The Senate appropriation analysis highlights potential for significant health savings to public and private payers. Unfortunately, more than 3,800 children under the age of 18 whose brains are still developing are the most susceptible to the addictive quality of nicotine. Start smoking every single day. It is estimated that 90% of lifetime users start before age 21, 80% first experience before the age of 18. Despite the high rate of underage experimentation, illegal possession of often not driven through legal sales, the STAKE Act has been successful in driving down illegal sales to minors. Rather, youth tobacco users are furnished through legal sales to those 18 and older or who are turning supply to their underage friends. By targeting this population, this bill seeks to stop our youth from experimenting with the addictive and this deadly drug. The Institute of Medicine, which recently reported that increasing the age to 21 result in over 250,000 fewer premature deaths before born between 2000 and 2019. This bill is a major step towards keeping the poisonous and ultimately deadly products away from our youth and members, and with that, I respectfully ask for an aye vote.
Members, any debate or discussion? Any debate or discussion? Seeing none, Secretary, please call the roll.
Allen? Aye. Anderson? No. Bates? Bell? Aye. Berryhill? Block? Cannella? No. De Leon? Aye. Fuller? No. Gaines? Galgiani? Glazer? Aye. Hall? Aye. Hancock? Aye. Hernandez? Aye. Hertzberg? Hill? Aye. Hueso? Aye. Huff? Jackson? Aye. Lada? Leno? Aye. Leva? Aye. Liu? Aye. McGuire? Aye. Mendoza? Aye. Mitchell? Aye. Monning? Aye. Morlock? No. Morrell? Wynn? Nielsen? No. Pan? Aye. Pavley? Aye. Roth? Aye. Runner? No. Stone? Aye. Vidak? No. Wachowski? Aye. Wolk? Berryhill, no.
Senator Hernandez moves the call. We'll now move to...
It's all right, it's on call.
It's on call. You'll have another opportunity, yes. So we will now move to file item 6. Senator Bell. Secretary, please read.
Senate Bill 10 by Senator Bell, an act relating to cigarette and tobacco product licensing.
Mr. President, members, in 2003, California enacted the Cigarette Tobacco Products Licensing Act. This established a statewide licensing program administered by the Board of Equalization. The act was established to reduce untaxed distributions and illegal sales of cigarettes and tobacco products. Now, under the act, the tobacco retailers must provide a one-time fee of $100 to each location they sell cigarettes and tobacco products. The license is valid for 1 year, and then they must renew it annually, but with no additional charge to renew the license. Tobacco distributors and wholesalers instead pay $1,000 annually every year. The current licensing fee structure does not generate, obviously, the necessary revenue to cover the cost of administration and enforcement for the licensing program. But both the LAO and the Board of Equalization have published reports that outline the inadequate funding of the licensing program. In 2013 fiscal year, it cost approximately $10 million to run the program, while revenue was a stagnant $2 million. That leaves an $8 million gap. To make up for the shortfall, special funds that support programs for childhood development, tobacco education and prevention, tobacco-related disease research, health care for low-income persons, among others, are charged the cost of administering the licensing program. This puts cost pressures on our Medi-Cal programs and decreases the efficiency of the healthcare system. Now, to remedy this problem, this bill, SB 2X10, will eliminate the need to divert the tobacco excise taxes from their intended purpose to pay for the deficit in the tobacco licensing program by the following steps. First, it replaces the current one-time $100 fee for tobacco retailers with an annual $265 fee, increases the annual fee for tobacco wholesalers and distributors from $1,000 to $1,200. The increase will result in approximately $12 million in revenue for the Board of Equalization to administer this program. This results in a cost recovery program that does not require subsidies from these vital health care programs. I urge and I vote. Thank you.
Thank you, Senator Bell. Members, any debate or discussion? Any debate or discussion? Seeing none, Secretary, please call the roll.
Allen? Aye. Anderson? No. Bates? No. Bell? Aye. Berryhill? No. Block? Canella? De Leon? Aye. Fuller? No. Gaines?
No.
No. Galgiani? Glazer? Hall? Aye. Hancock? Hernandez? Aye. Hertzberg? Aye. Hill? Aye. Hueso? Aye. Huff? Jackson? Aye. Lara? Aye. Leno? Leva? Leno, aye. Leva, aye. Liu? Aye. McGuire? Aye. Mendoza? Aye. Mitchell? Aye. Monning? Aye. Morlock? No. Morrell? No. Wynn? No. Nielsen? No. Pan? Aye. Pavley? Aye. Roth? Runner? No. Stone? Vidak? No. Wachowski? Aye. Wolk?
Senator Bell,
Galgiani, no. Hancock, aye. Glazer, no. Stone, no.
Senator Bell moves the call. Members will now move to file item 7. Senator Liu, Secretary, please read.